Hello, I'm Dr. Nicholas Wride, and I am a consultant ophthalmologist at the Sunderland Eye Infirmary in the United Kingdom. My clinical interests include surgical management of cataracts and glaucoma. Maintaining a low intraocular pressure and avoiding pressure surges during phacoemulsification can reduce the risk of complications, which is especially important for people with diabetic retinopathy or glaucoma. The Centurion Vision System with the active Sentry handpiece allows surgeons to reduce surges and maintain a lower intraoperative intraocular pressure. Our recent study evaluates the effects of low or near physiological intraocular pressure versus standard or higher intraocular pressure during phacoemulsification, while also evaluating surgical and post-operative outcomes in patients with diabetic retinopathy or glaucoma. In this observer-masked randomized controlled feasibility trial, 70 eyes of 70 patients with either diabetic retinopathy or glaucoma underwent routine phacoemulsification surgery using the Centurion Vision System with active Sentry with either low or standard intraocular pressure settings. Key outcomes included cumulative dissipated energy used and other surgical metrics, as well as post-operative outcomes like anterior segment properties and OCT angiography measurements at post-operative days 1, 21 and 40. There were no operative complications in any study groups. There were no significant differences between the two pressure groups for cumulative dissipated energy used or any other surgical metric. There was a non-significant trend towards a shorter case time in the low intraocular pressure group. OCT angiography showed that both foveal avascular zone perimeter and area were significantly lower at day 21 than at baseline in the standard intraocular pressure group, but there was no difference between these time points in the low intraocular pressure group. Notably, both parameter measurements were significantly different between the groups at day 21, but not at baseline or day 40. There were no significant differences in any other post-operative parameters. These results showed that phacoemulsification with the Centurion Vision System and active Sentry at higher intraocular pressure of 60 millimeters of mercury and lower near physiologic intraocular pressure of 30 millimeters of mercury provides similar surgical efficiency and anatomical outcomes in patients with ocular comorbidities. The near physiologic intraocular pressure group showed less reduction in the foveal avascular zone.